All right, as we look to the weekend, also happening tomorrow, the lifting of what's remaining of Ontario's mask mandates, at least for most settings here. More and more people will be choosing whether or not to continue to wear one. Regardless of your decision, let's get you a refresher on best practices when it comes to masking up. Joining me now, Dr. Clase, McMaster University Professor of Medicine and member of the Center of Excellence in Protective Equipment and Materials. Dr. Clase, thank you for joining.
Good morning. Thank you very much for having me.
I want to first just get your take on the lifting of the mask mandate in many settings. One of the ones where people are putting a spotlight on is something like transit. We know it's going to stay in long-term care, retirement homes, and a lot of hospitals, most hospitals choosing to keep it in play. But what is your take? Is this too soon or are we ready?
Well, we'd all want the pandemic to be over at this stage, but it isn't. In Ontario in May, 350 people died of COVID. Yesterday, Dr. Tam warned us to be prepared for future waves. We don't stop washing our hands when infection rates fall, and we shouldn't stop wearing masks either. So this is a provincial responsibility. The province should have extended these mandates. It's great that hospitals are stepping up. But the public really has the right to know that wherever they seek healthcare, they will be safe.
So we actually spoke to a number of viewers yesterday, and it was interesting. A lot of people said they're going to continue to mask up in the settings where it even is no longer mandatory, like in transit, where there isn't distancing. And so that's positive news. But if you're looking at your masks right now, some people are looking to reorder masks, or they're looking at their current stock of what they have, and they're saying, well, what is actually most effective at this point? Let's break down a little bit for our viewers, because there are so many that are out there. What is most effective if you're going to continue to wear those?
Oh, that's a great question. So the most effective mask is going to be an N95 type mask. These are the masks that we wear in healthcare. So the certified N95 is going to give you great materials, great fit, and it's got an overhead elastic, and that pulls it tight to the face, and we think that that's really important. Now, in healthcare, we're going to be fit tested for that, and we're going to have a greater than 99% protection. Here you can see the features that give it that great fit to the face. Public doesn't have access to fit testing, but particularly for modern designs like this one, they'll fit lots of people really well, and they're much better than blue medical masks.
Mm-hmm. Dr. Clase,
they're the most expensive.
Oh, sorry,
yeah,
go ahead.
The downside of N95s is that they're more expensive and they require health literacy to find them, and that's an equity issue, obviously. Mm-hmm. But you can reuse them, you can use them extended periods, and they are likely much more comfortable than you might think.
I remember at the beginning of the pandemic when there was such a shortage in PPE. And we have come a long way in what is available. Do you think that masks are going to become part of the fabric? You know, when we see another virus come about, like, masks should be readily available, that the public will be used to wearing them, and we should be able to have that supply at our fingertips.
Yeah, so there was very little domestic Canadian manufacture of N95s before the pandemic, as people know, and mask manufacturers in Canada really stepped up, and there is now domestic supply. But mask manufacturers need steady supply. They don't need it to come and go in waves, and actually new manufacturers went out of business last year. So it's really important that when we look at our masks, we think about what we're going to buy now and what we're going to buy in the future, and we make it sustainable and steady, because mask manufacturers can cope with that, and they're ready for that, and they will be able to step up.
Finally, for you, as people make these decisions, you know, something like, I always use transit as an example because it, again, will no longer be mandatory, but it is strongly recommended. We heard Mayor John Tory say it. We heard TTC officials say it. What is your advice to people moving forward where they say, should I or shouldn't I?
In general, I think that if you're in an indoor public setting, you should wear a mask. You should be choosing very carefully who you don't want to be wearing a mask with, based on your own risk profile and based on the setting. So the settings that are dangerous are crowded spaces, indoor spaces, lots of people singing, shouting, exercising, dancing makes it worse. Ventilation and air filtration could make it better, but it's hard to get information on that. In terms of looking at your own personal risk, there is that risk of long COVID, 9% in adults of all ages, triple vaccinated. Very reasonable not to want to get COVID still.
Dr. Clase, we appreciate you taking the time with us this morning. Thank you so much. Have yourself a wonderful weekend.